Hello, hola, Marco. So, I have my panniculectomy, my tummy tuck, which is not actually a tummy tuck, um, set for tomorrow. Uh, Last Friday, I went to my pre-op follow-up exams. I first had an echocardiogram, and then I had a stress test. They went pretty smoothly. The echocardiogram took about 20 minutes, and the stress test also took about 20 minutes, more or less. I was at the hospital for about an hour, a little more than an hour, really, because wait times. Uh, and the results seem to be okay. And I say seem because no one actually went over the results with me. I got the results on my medical portal. So, according to the conclusions for the echocardiogram, there was a whole list of just medical and anatomical terms. I didn't know what most of them were. But basically, the conclusions were that my left ventricle systolic function is normal, whatever that is. My left ventricle cavity size is dilated. Again, I don't know what that is. My right ventricle systolic function is normal. My left atrium is mildly dilated. My mild tricuspid regurgitation. Wait, I have mild tricuspid regurgitation. No prior study available for comparison. Okay. When I went with the technician into the room, big room. There was chairs, desk, and the echocardiogram machine. And next to the machine was the bed. I took off my shirt. I laid down flat on my back, and he began with the wand, for lack of a better phrase, over my heart. Started checking. Okay. Then he had me lay on my left side with my back facing him. And then he put his arm over my body and started to do the wand up my left side this way. I'm not quite sure why he did it that way, except that if you have your... Let me think if I can't find something. Hold on a second. Okay. So, from what I could gather, okay, so you're lying flat, and you have the wand on your chest, and I guess the sound waves are going through, right? Then I lied on my left side, right side, and he put his hand over my body and put the wand up underneath my left side, and I guess the sound waves are going up. He did that for a while, for a long time. That was most of the exam, actually. It was kind of uncomfortable. He was holding that position, and I was getting cold. Then I went back to my back, and he put the wand like underneath my rib cage. So the wand was here, and then he moved it up underneath my rib cage this way, I guess to see the image coming from beneath up. And then he did the same thing back here, to my throat, to see it going down. And again, the results seem to be normal. Again, no one talked to me about the results afterwards. And I am not going to volunteer anything that could possibly postpone the surgery. So, again, everything looked fine, looked normal. I'm not sure that there's any issue with a dilated left ventricle cavity or a mildly dilated left atrium, but no one, again, contacted me about it, so I'm going to assume everything's okay. After the echo, I went and did the stress test. My cats, what are they doing? Okay. After the echo, I went and did my stress test. There was no mask. Again, fairly large size room. There was a treadmill. There was a bed. The technician, she, was very nice. She was very comforting. I explained to her what was going on. She was very personable. Great. I again took my shirt off. I laid down on the bed. She hooked up all these wires to me, with the paste and the wire. And then she explained what was going to happen. The treadmill is going to begin at a slight elevation and at a certain slow speed. And then it would go up a little higher, then a third time, and then a fourth time. And every time it would get faster and faster and faster. What she said was that they want to make sure or they want to see until my heart rate goes up to 144 beats per minute. That's when the stress test has met its goal. So I got on, I held on to the bar, started walking. It's pretty simple, pretty easy. It got more and more difficult as it went, of course, because the elevation got higher and the speed got higher. The first, I don't know how fast I was going in the first set or the second set, but on the third, I was going about 3.1 miles an hour, which for me is kind of quick. And then for the fourth, I was like almost a 4. So I was almost running at that point. And I was out of breath. Definitely getting out of breath, sweating. And then the whole thing again lasted for about 20 minutes because you're at that level for about 3 minutes each. And then, setting everything up. It took about 20 minutes. Brought it back down again. She didn't immediately tell me. I asked her, how did I do? And she said, she said she gave me, it looks well, okay, but she couldn't go into any details. I also asked the echocardiogram technician, how did I do? And he said specifically he couldn't tell me. Don't know why he couldn't, but he couldn't tell me. Okay, I didn't get the results until later. Again, back on my health portal, and again everything looked normal. For the stress test, so what are the results? Okay, sinus rhythm, right branch bundle block, first degree AV block. Functional capacity, normal. Heart rate response to exercise, appropriate. Blood pressure response to exercise, appropriate. Chest pain, none. Arrhythmias, none. ST changes, difficult to interpret due to excessive artifact, but no clear diagnostic changes of ischemia. Overall impression, probably normal. Probably normal. Okay. Conclusions, probably normal. Probably normal treadmill stress test. Interpretations of ST segments is made difficult by significant artifact related to patient's excessive skin. Good exercise tolerance for age and no clinical symptoms. Okay, cool. Again, no one went over these results with me. I don't know what ST segments are, and I'm not gonna, again, I wasn't gonna volunteer anything that could possibly postpone my surgery. So as far as I'm concerned, I was good to go. Okay, that was last Friday. Then this Monday, I had a call with the nurse for the operation. The nurse had a bunch of questions. Okay, so let's go over these questions. Okay, first off, where am I going? Okay, she wanted to make sure, verify where I'm going. She wanted to verify, what surgery I'm having. I didn't know what time to actually show up because the appointment is on the health portal, but it didn't say an actual time. So I had to ask about that. My surgery is at 11:45, but I have to be there by 9:45 a.m. And I have my brother who's going to drive me there, which is something they asked me. So they asked me a bunch of questions. So one of the questions was, my height, my weight, am I allergic to anything, any particular medicines, any other kind of allergies? I was asked, have I been around people who have been sick in the last 10 days? COVID testing, last 10 days. No, I haven't. Do I have any implants in my body? No, I haven't. We went over my surgical history. I've had a colonoscopy. I actually had bariatric surgery. But other than that, I didn't have any other, medical history of note. I was asked if I had any anesthesia problems or problems with anesthesia. I've never had any, as far as I know. So I said no. Have I ever had any difficulty with a breathing tube? No. Have I ever experienced high fever during operations, either myself or anyone in my family? And not for me. And as far as I know, no one in my family has had high fever experience during operations or after operations. Sleep apnea, because that was in my medical records. I no longer have sleep apnea because I've lost so much weight that I can breathe now. I don't need my CPAP machine. My heart rate. Again, I used to have high blood pressure, and that was in my medical records. I explained to the nurse that I no longer have high blood pressure, and I no longer take any medications for high blood pressure. So, good. She asked if I had irregular heart issues. I said no. Again, I'm not going to postpone this at all. And in my records, it says I have a right branch bundle block, and she did have my records available, and she did mention some of the things in my medical records. So I'm assuming she would have known that. So I said no. Do I have any lung problems in the last 4 weeks? Shortness of breath, anything like that? No. Do I have any neurological issues? Nope. I'm just the same as most other people. Do I have any acid reflux? Any problems with my stomach? Nope. Any liver problems? Nope. Any kidney disease? Nope. Any diabetes or thyroid issues? Nope. Any bleeding disorders? Nope. Did I receive a blood transfusion recently? And have I had problems with accepting blood transfusions? Never had problems. Haven't received any. Have I ever had cancer? No. Any infectious diseases? Besides the cold? No. Have I had any anxiety, depression, or mental disorders? Nope. Do I have any ear or eye problems besides the fact that I need glasses? No. Do I smoke or drink or do drugs? No, none of that. This is odd. Do I have loose teeth in my mouth? I didn't ask about why she was asking that, because again, she was just going through a list of questions, but that's odd, okay? But no loose teeth in my mouth. Do I need any assistive device, like a cane? Nope, none of that. Then she asked me who is going to be with me for the surgery, because again, I need to have someone there with the surgery. They're not going to let me just go and have the surgery without having someone who can drive me there and drive me back home, because I'm not allowed to drive for the first 2 weeks, at least for the first 2 weeks after the surgery. So I told her my brother's going to drive me, and actually now my father's going to come too, because my brother's going to drive me, let me go back home, and then he can come back, but my father's going to stay with me the entire time. Then she went over parking, where to park, what hospital elevator to take, where to find the actual, space that I'm going to be at. She told me I have to bring my driver's license and insurance. No food after midnight, and I stopped eating a while ago, like 8, 9, 10, 11, like 3 hours ago. It's like 11:30 now, so I stopped eating a while ago. I can have clear liquid allowed, small amounts. I need to brush my teeth. No aspirin or anti-inflammatories. No body lotions or no powders. I remove any jewelry, so I'm gonna have to take this off, and that was it. Yeah. So I've taken some before pictures, and once I have the surgery, I'll take some after pictures, and we will see what the results are. I am a bit anxious. I am a bit nervous, mainly because I remember the bariatric surgery I had, and that was painful. I mean, for 3 days, it wasn't the worst pain ever, but it was sore. I was sore and in pain for like 3 days. Not excruciating pain, but it wasn't good. It wasn't fun. Funny story though. So I go to CrossFit, and I have other CrossFit members there, and one of the ladies at CrossFit, I was explaining to her what was going to happen, and she told me how she had 3 kids, all through cesareans, right? And she starts explaining how they not only cut into the skin and the subcutaneous tissue, they cut into the muscles. There's like 7 layers of muscle, and she was getting kind of graphic about it, and I'm like, what? Okay. And she goes, oh, but no, you'll be fine. Okay. They're not going to, they're not going to go that deep, right? Right. Okay. I guess not. I'm pretty sure they're not, but okay. And then she said, and the point of her explanation was because I was, again, concerned about how long I was going to be in bed, how long it was going to take me to recover, that kind of thing. And she said that on her 3rd cesarean, she was still in the hospital after giving birth. Okay. She was still in the hospital, and a nurse came in and told her, okay, time to get up, time to take a shower, okay? So she had more intensive, invasive surgery than I did, and she was up, moving around, I think within a few hours after giving birth through cesarean. So basically she said, man up, you'll be fine, okay? She did say that it would, along the cut line, it hurt, like burning sensation, and then as she healed, it itched. So I anticipate some, burning sensation along the cut line, some uncomfortableness, and I was again told that I should not lie in bed or sit all day. I should get up every so often to avoid blood clots. So yeah, that's where I'm at. I have my surgery in 12 hours. wish me luck. I'll let you know how it goes. Adios. Oh, wait. One more thing. One more thing. So, insurance. I got a mail, an actual physical mail, from my insurance company saying that they are going to pay for it. So, that was good. That was a relief. I'm pretty sure that it couldn't happen anyways. Again, the insurance lady that I spoke with, she was very confident that they would pay for it. But it's nice to have it in writing, you know? Nice to have it in writing. Yeah. Yeah.